I'm very pleased to be here in Ghana to talk about cardiac surgery in Morocco, and especially in Africa. My presentation is more about Africa than in Morocco, because in Morocco there is many centers and cardiac surgery is well performed. My English is not very good, so maybe I will speak in French in the middle. And sorry about that. Okay. As you see in the first presentation, we put two addresses. The first address is the cardiac surgery, the center where I work in Casablanca, and the second address is a society we have developed because we have a lot of people coming from Africa and for demanding cardiac surgery which cannot be done in their country. So the question is why telephone triage in Africa is very developed and not cardiac surgery. Why technology is in many countries and not cardiac surgery. And when we think about that, I think that the responsibility is for the governments and for us also as a cardiac surgeon, because we have to speak about that. There is a lot of people dying, and everybody wants to call on telephone and nobody wants to operate in the countries. Next slide, please. So as you see, for the population, when we compare the population of surgeons versus the population that have been to be operated in open heart surgery, we see that in Africa there is only 1% of the population of surgeons, and we have to perform normally 4,100 operations per million. And each surgeon have normally to perform 300 operations per year, and we need one theater for 300 operations per year, and at least 4 or 5 beds in ICU for this theater operation. But these conditions are not done in all the countries, even in Morocco and Tunisia and Algeria, but also in the countries in sub-Africa. Morocco, Tunisia and Algeria are African countries, and we didn't accept that in sub-African countries there is no cardiac surgery. There is a lot of courage for Ghana, Senegal, Côte d'Ivoire to begin this program, but I think as an African, that's why I am here, and I represent North Africa. I cannot accept that in Gabon, that in other countries, that in Mali, that in different countries there is cardiac surgery, and we have to do all what we need to do so that programs begin in that countries. Next slide, please. So in Morocco, we have 35 million persons. Half of the population for the moment have a social security. There is 6 public centers and 10 private centers, and I stop for this moment because the private centers have developed more quickly than the public centers, because the social security cannot be done. There was a lot of discussions about creating centers, and the bank in Morocco gave money to create. So many centers came, and actually 60% of cardiac surgery is done in private centers. We have very performed public centers, but the demand is huge, so we have to find place to operate people. In Morocco, there is 40 senior surgeons and 13 residents. And maybe next year we will take 20 more residents for us in cardiac surgery. We practice now 3,000 open heart surgery per year. It's not a lot for the population. And in the 2 second years, there will be a generalization of the social insurance. And for the Association of Cardiac Surgeons, we said to the government that we will not accept this generalization if there is no partenariat, public, private, public. So people are free to go to operate in the hospital or in the private sector. And we need to do 5,000 interventions in the 2 next years. Next slide. So there is 3 axes for the development of cardiac surgery in Africa. For me, I think it's the development of manpower, development on infrastructures which are equipped and really think in the first before to begin anything for cardiac and thoracic surgery. And also we have to adapt the solution for the reality of the countries. Next slide, please. What can we do? Each time when we speak with government, with ministers, as all the countries, the same response is, there is no money, there is money. There is everything. we have to find it. So surgeons have not to accept that there is social security in many countries in Africa and cardiac surgery is not covered. It's a nonsense. If there is social security, cardiac surgery have to be covered, and cardiac surgery is classed in l'OMS as affection longue et coûteuse. So it have to be covered. And we need collaboration with industry, government for partenariat public-privé, and of course, when we speak about formation, about, how we said in English, teaching, we have to invest. Teaching is money. It's not word. So we have to invest. Next slide, please. So in Africa, there is 55, I think that ces chiffres sont corrects, 55% of congenital disease, 45% of acute cardiopathy, and 3% of coronary. I'm sure that is false because there is no cath lab, so there is no diagnosis of coronary disease. In Morocco, we have these numbers 10 years later, but now we have 40% of rheumatic disease, 25% of cardiopathy disease, and coronary disease is more and more, and we have a lot of stenting and the coronary bypass. Next slide, please. In Africa, there is also VIH syndrome with the cardiac disease associated, so many people have to deal with that pathology that we don't know exactly well in our countries. Next slide, please. And so why in these countries where there is no cardiac surgery, it is important to do something, because we have young patients. We don't have to forget that our young patients, they can treat and they can give something to their country. Souvent, it is a fetal treatment. They can die if we cannot do anything. They cannot go abroad. It is expensive. And there is difficulties for the countries to begin a program. They need help. There is investment which are important. People are afraid about an échec. They cannot do because if they begin, they have to begin well and they have to get results. So all that problems are behind a new program, and every group of surgeons, of cardiologists and surgeons who want to begin, they have to be sponsored and accompagné. Next slide, please. Our goals in our group of surgeons in Morocco, we discussed about this before I came here. So we need to organize units in different countries where there is no cardiac surgery, or to assist. We want to help. We want to help for a local teaching or nurses who can come to Morocco to perform and deal about cardiac surgery, to learn. We need to create centers with you, there is quality of medicine, and first begin slowly by closed procedures and then open procedures with valvular, coronary, and then pediatric congenital disease, as the program performed in Rana, which is a good example. Next slide, please. What we propose is a regular visits with big teams, which we can find many 2 or 3 surgeons who are dedicated for this surgery, and they want to perform, and cardiologists who can prepare many patients so that the program and the visits can be comfortable for the local team. Of course, we propose to come with a team's complete, and to a direct teaching for the local surgeon who want to perform. They have to come to Morocco to teach there also, and to encourage responsibilities and to demonstrate a teamwork. Next slide, please. So for that, nothing can be done in cardiac surgery if there is a huge team of cardiology accompanying this program. Cardiologists and cardiac surgeons have to be the 2 hands and work hand by hand. And also there is a necessity of introducing non-invasive and cath lab program. As we see in Senegal, I visit the cath lab in Dakar. It is really superb what they've done, and now everything is performed. Coronary disease are diagnosed, and I'm sure that 3% will become 35%. And of course, introducing new techniques and non-invasive techniques is very important in our countries. Also, the ICU is very important. Nurses, doctors have to get simple protocols, because now cardiac surgery is codified, so there is simple procedures, simple protocols. We need a lot of nurses teaching, creating pedagogic outils, and quality of the mission, and of course l'hygiène avant tout in réanimation. Next slide, please. For that, when we want to create a unit in ICU, we have to choose if it is open or closed. We prefer now in Morocco to put rooms who are closed, not open ICU. It is very important for the patient and for la gestion d'un patient en réanimation. And the operating theater is a standard. It's not have to be very expensive. It can be very simple, but well done. And for that, we create this society, which is Global Health Conseil, who have 3 missions. The first mission was the évacuation sanitaire. People who don't know where to go to can be operated. And when we have this demand, who was more and more, we create this society with different surgeons for neurosurgery, cardiac surgery, traumatology, and there is now people who working who can do évacuation sanitaire. We can perform humanitarian missions and mission of formation. So the goals is the assistance and logistique and conseil, logistique, social, medical or administrative. And next slide, please. And the other mission is la formation de personnel sur place, teaching, raccourcir l'apprentissage, technique and organization conseil, and trying to give a medical prestation which is correct in a small town, in a small time. So I thank everybody for this invitation, and thank you.
Thank you.